check levels for one of the outlets. Levels 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Sergeant Vince Lewis. Good. All right. Thank you. Phoenix Police. Okay. Thank you. Again, we're on time to start. Thank you.
One more time, Sergeant.
Sure.
1 second.
One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. You good? Thank you.
Thank you. 1
Good afternoon. I'm Sergeant Tommy Thompson of the Phoenix Police Department. That's T-O-M-M-Y-T-H-O-M-P-S-O-N, and I am one of the spokespersons for the Phoenix Police Department. At this time, I want to thank you for being here, and I appreciate your patience. The incident I'm going to discuss, this investigation, started on the 29th of December. And one of the reasons we waited to put any information out, and again, for some reason that was a frustration for some of you, was that there's a window of opportunity for investigators to gather evidence and information. And so I appreciate those of you that were able to help us with that. On December the 29th, 2018, at approximately 3:42 p.m., Phoenix police officers responded to a call of an infant who had coded at a long-term care facility in the area of 1400 East South Mountain Avenue. Coded is a term in a radio call where someone is in distress, having trouble breathing, or unconscious. Now, when the officers arrived, they found that a woman in her 20s was incapacitated. Some have asked what that means. This woman was unable to move. She was unable to communicate. In other words, she was helpless, but she was incapacitated. This woman had delivered a baby. The baby was in distress, and that's what the original call came out as. Now, the woman and the baby were transported to a local hospital, and at this time, it is my understanding that both the baby and the mother are recovering. Now, the mother had been in the care of this long-term care facility for a number of years. And because of the circumstances surrounding this incident, detectives from the Phoenix Police Department Family Investigations Bureau Sex Crimes Unit responded to the scene and immediately began a sexual assault case, an investigation. Since that time, they have diligently been working to identify or attempt to identify a suspect in this matter. Now, I want to point out that from the get-go, we've had assistance from our state partners, from the Arizona Department of Health Services, the Division of Developmental Disabilities, the Department of Child Safety, the Arizona Adult Protective Services, as well as Access. In addition, we worked closely with the Maricopa County Attorney's Office, who will handle any prosecution in this case as we go forward. At this time, our investigators have asked that we move to a different phase or an additional phase in the investigation. We are now at a point where we would like assistance from the community. I mentioned that we gathered evidence and information. Now we need information. If anyone has anything, if they have information for us that they think might help us in this investigation, we would like them to come forward to contact us. I have several numbers. In the flyer that I put out in the advisory, I listed the Violent Crimes Bureau, which is at 602-262-6141, but also they can call the Family Investigations Bureau, and that number is 602-534-2121. And of course, our partner in this will be Silent Witness, and that is the number where you can call it 480-WITNESS for English, and for Spanish it is 480-TESTIGO. But they are there to answer the questions. Now let me bring you a little bit up to date on some of the investigative techniques that we've used thus far. First of all, some of you asked if we've identified a suspect, and we have not. I will tell you that our detectives are working diligently to try to identify a suspect. There are several things that have been done thus far that some of you have heard information. I know there have been a number of sources that have contacted the different news outlets. And let me just say that some of their information has been correct, some of it has not been. We have
That is the big headline we learned from police just right now. We also know that there has been a search warrant served to collect DNA from male staff members there at that facility. Let's bring in Sonu Wasu now as we wait for that signal to get reestablished one more time. And the state has also sent others into the facility to check on other patients there, right?
That's right. We have the State Department of Economic Security. They have sent a team down to Hacienda Healthcare basically to make sure that all the patients in that facility are well taken care of. We've also got the Arizona Department of Health Services that have been sending people down there. Now they monitor all of these agencies, so their job has been to make sure that security is stepped up in the facility. They've been looking at increasing staff presence in rooms and also in areas where patients hang out. Now I did talk to a former caregiver who took care of this patient for many, many years, and she, like so many, is disgusted, horrified, saddened to hear about this. She tells me that she just doesn't believe how no one, not one nurse, not one therapist, a certified nurse's assistant could have noticed the changes in this woman's body. Now we're talking about a full-term pregnancy here that was missed by these medical professionals. I'm told that these patients are monitored by a team of healthcare workers every single day. We've had sources tell us that there were obvious physical indications that this woman may have been pregnant. So the big question that no one has answered for us yet is why there was no follow-up if that were the case. The former caregiver for this woman also says that she has been having nightmares about all of this. It has affected her very deeply, and she just does not believe that so many medical professionals, again, could have missed something like this.
I can't believe it at all. I can't believe that somebody would bathe her daily for 9 months and never know that she wasn't having a period, that she wasn't growing in her midsection, that nurses weren't keeping track of weights. Those things are shocking to me.
The community also in disbelief about this. How could something like this happen? Now, the caregiver also tells me that staff there are required to perform bed checks on all of these patients every 15 minutes. So, was this happening? We asked her that question, and she basically said, they did it sometimes, but there
I
were
don't
times
know if
when
there's
staff
been anybody
would get
that's
lazy. She
declined.
admitted that.
Again, in many instances, that's why we go with a court order to get that, in case that's...
allowed to decline, and if so, is there something that police can do to make sure that they get that swab?
The process is we ask people voluntarily, and sometimes people have the right to refuse, but then we come back with a court order, and then they have to do that. Nicole.
As far as the DNA samples, is it accurate that male staff members at that facility were part of that search warrant to get the DNA? And as far as, was there a log or a list of any other visitors or family members that may have been swabbed as well?
Nicole, that's a great question. Let me just say that we're not going to point out who we've obtained DNA from or who we intend to get DNA from. But suffice it to say, it is a large number of individuals that we will gather evidence from.
So, Sergeant Thompson, can you talk about how quickly that DNA will be tested? Hacienda went out and said that you did test all the male employees. Now that you're asking for tips from the public, is it safe to say you've ruled out all the male employees there?
No. I can't confirm or go into any of the information that different entities have put out in press releases or information. It's inaccurate to say that we tested that DNA. I think it's accurate to say we obtained DNA samples. That process can be a long process, but we're prepared to go through that process.
Are you trying to expedite it?
We're doing everything we can. And let me point out that this is of the highest priority to the Phoenix Police Department. And again, from day one, we've put our efforts into it. We continue to put our efforts into it. Whatever assets that we need to throw into this investigation or to provide for it will be provided.
So are you looking into staff knowing that this woman was pregnant and if they tried to hide this matter?
We're looking first to find out who was responsible for this and following our investigation wherever it takes us.
Are you looking at, are any other departments working with you on this investigation, like the Department of Health? And furthermore, is there any sense that the people that are currently in this facility being taken care of who are also incapacitated are in any danger at this point?
Very good question. At this point, it is our understanding that steps have been taken to protect anybody that's there. And that was one of our concerns from the beginning, anytime we do an investigation like this. And that's one of the concerns we have when we delay coming forth and putting out the information about what type of investigation it is. But in answer to your question, all of the state agencies, again, the Department of Health, the Adult Protective Services, the Department.
Something you're looking at. Are you also looking outside, possible guests to the facility or people who may be contracted?
Again, some of the questions you have is who are we testing?
Specifics, just the generality of people you're looking at.
Let me just say that we have a very wide scope at this point. At this point, I don't know that anybody's been ruled out because the investigation, again, is still, even though it happened on the 29th of December of 2018, this is still progressing. We're still going forward with it.
Does the facility have a log of who accesses patients when and when?
Questions like that would have to be answered by the facility itself. The investigator, I don't know what evidence specifically, but keep in mind we did have search warrants and obtained evidence, and I don't know specifically the evidence that they obtained in the written form. In English, so that I don't miss in translation.
Okay, it's because we're transmitting live right now, streaming live the interview. That's why I would like to ask you in Spanish if it's okay with you.
Sure, I'll do my best.
Okay. La joven que fue embarazada, que dio a luz, ¿en dónde está? ¿Continúa ahí en el hospital?
La madre y el bebé están en el hospital en este momento. No sé exacto qué es el hospital, pero ellos se están recuperando en este momento.
Pero no están en Hacienda Healthcare.
No, ellos no están aquí porque ellos están en el hospital.
Okay. Una última pregunta.
Okay.
Si nos pudieran repetir para la audiencia en español en los exámenes de ADN que realizaron. The DNA test that you guys conducted yesterday. If you could just repeat it a little bit again.
Ok, estamos tratando de obtener la información por medio de DNA, así podemos identificar el sospechoso. En este momento no tenemos la información para identificar quién exacto es el sospechoso.
Sergeant, can you tell us again in English what happened with the child that they both in the hospital currently, the baby and mother?
Okay, as you can imagine, again, go back to the night of the 29th or the afternoon. It was just about 4 o'clock in the afternoon. Police officers responded, fire department personnel responded with an infant code. And as you can imagine, as police officers and as fire personnel, when we respond, that is of the greatest priority for us to save a life. And when we arrived, that's when we found out that a baby had been born and was having issues. That was the nature of the call. That's what started this on the 29th of December. They're in a local hospital, and they are recuperating. Recovering is the best I can say. I don't have a lot of updated information, but I am happy to say that both baby and mom are doing well.
Can you offer some clarity about the physical state of the victim? You describe her as incapacitated. Does that mean is she unconscious? Is she like in a coma, or is she not able to move and communicate, but she's conscious? I'm trying to figure out if she was aware of what's happened to her.
The information I have is that she has been in a the term that I would use is a vegetative state is the term that keeps getting thrown around. This person was a young person, suffered an injury, and has been in long-term care for quite some time.
Does that mean she was awake during the assault, or possibly awake? Maybe her eyes were open?
I don't know that she was able to communicate, so I don't have any information on that. But suffice it to say, and this is a key point in this investigation on why it is a sexual assault, is she was not in a position to give consent to any of this. So if anyone can understand that this was a helpless victim who was sexually assaulted.
Do you confirm if the baby was full term?
I don't know. I'm not a medical professional, but I'm told that it was quite a ways along.
And has this investigation expanded beyond the Hacienda Healthcare Center in South Phoenix? Has it expanded to other Hacienda Healthcare centers in the valley?
Well, as you might imagine, our focus right now is on this facility in the area of 1400 East South Mountain. Obviously, because of the network that we deal with of employees, could you see police officers at other locations? Yeah, that's very possible.
Is it fair to say that this might be a cover-up or conspiracy here? You don't go from pregnant to giving a child overnight. In the last 10 months, 9 months, someone would have, they changed the woman, they bathed the woman. There would be telltale signs that she was pregnant. So how, did it just come to light on the 29th? Or is the hospital claiming that they had no idea this woman was pregnant for the last 9 months?
You're asking good questions that I can't answer. I'm led to believe that this came to light when the child was born.
To go off of that, do you believe that anyone at Hacienda knew that this woman was pregnant and failed to report it?
I have no idea.
Or is there a possibility that people inside of Hacienda could have known about it?
I think it would be pure speculation on my part to render an answer to that one. I don't know.
But I mean, someone would have to.
Police also considering a cover-up. Are they investigating a cover-up by Hacienda?
Right now, we're investigating a sexual assault. That's what we want to do right now. And again, wherever this investigation takes us, we're prepared to go forward with it.
We've heard reports that she was sexually assaulted multiple times. Do you know that this was a pattern with this patient, or was it just possibly this one time?
At this point, what I do know, and I can't answer, is I know at least once she was sexually assaulted, which is way too many times.
So what about threats at that building? I know that there's an increased police presence. We have heard that they are now being threatened on social media.
Thank you for bringing that up. There have been threats to the facility. I don't know that they've had any specific threats to any individuals, but to the facility. So you may see off-duty officers there, which would be a situation that would occur. Any location that is receiving threats, the officers would be there. So yes, my understanding is they have received some threats. I don't know the extent of those. I don't know what the follow-up on that would be.
Does the search warrant also cover patients? Who does the search warrant cover when it comes to getting the buckle swabs?
Okay, you're dealing with two questions there. Search warrant is used based upon probable cause to obtain evidence such as reports, medical records, things that are protected under HIPAA. When we do a buccal swab, when we gather that evidence, that's based upon reasonable cause, and that's a court order. And again, it's going down the same question that's been asked, and I'm stepping away from it because of the fact that I don't want to mislead you as far as where we're going with DNA evidence, but just keep in mind, we still have a very wide scope of our investigation.
So does the search warrant have to name specific people, or can it name a general group?
Again, a search warrant is based upon probable cause, and the search warrants came forward to gather evidence from the facility, records, things of that nature. The court orders for the buccal swabs, yeah, those typically would have a name on them.
Sergeant, are there cameras inside the facility, and if so, do they keep any surveillance records, video-wise, going back how far?
I don't know what the status of any video inside the location is. I don't have an answer for that.
Can Phoenix PD legally ask the rest of the female patients inside this facility to take pregnancy tests to see if there are any other facility that could possibly be pregnant?
It would not be in our purview to ask people to take a pregnancy test. We typically would not do that.
Is the department looking into other patients possibly being victimized or sexually assaulted?
At this point, again, we're involved in one investigation, and it involves this woman. And again, keep in mind, as I said, we're prepared to follow that investigation wherever it takes us.
If the investigation reveals that people at the facility knew that this woman was sexually assaulted and chose not to say anything, is there a possibility that multiple people could face charges of some type for not reporting that or not coming forward and saying this has happened?
Once again, in our state, we have a duty to report. So in answer to your question, is that a possibility? Certainly that's a possibility. But again, we're still on we're on the investigation on the sexual assault involving this woman. Yes?
It's going to be a long investigation, a long process to get these samples back. How confident with what you have now are you that you will find the suspect?
I am confident in the ability of our investigators. Again, the Phoenix Police Department, in my opinion, is second to none. And I am hopeful and confident that we will find who committed this crime.
Sergeant, have you obtained DNA from that baby?
I don't want to go into a lot of details. Just let's suffice it to say DNA will be one of our key tools in this investigation. That plus information from the community.
Can you talk about how many police resources you have on this right now? How many men and women are working this?
Well, I can tell you that our Family Investigations Bureau has committed a lot of people. I don't know the exact number, but again, this is of the highest priority to the Phoenix Police Department.
When you say priority, when you talk about the backlogs in the labs, is this moving ahead of a lot of other things in the crime lab?
I don't know the priority, but certainly this is one we want to get to the bottom of. And we try to use the resources as best we see fit, but I'm here to tell you, because of the importance this has to the community, and again, I don't ever want to minimize any victims, the things that have occurred to those victims, but of course this is one that we're moving forward on.
Could Hacienda have asked for
I don't know that they haven't.
Could they have? Do you know if that's?
I don't know if they have. That's the question. Remember, as I mentioned, I answered your question earlier when I said that the first avenue is consent, asking people, will you give a sample? And generally that is adhered to where people will provide samples. And again, it's downrange where we go into the rest of it. So, last questions. Yes, sir.
¿Podría decirnos si el bebé es niño o niña?
No quiero contestar esta pregunta porque es importante que la identificación del baby y también la mamá, y hay no información así en 10 años se pueden identificarlo o identificarla. So you understand that question was, would I answer if it's a boy or a girl? I'm keeping that downrange because again, I'm looking at this baby as a member of our community that 10 years down the road, let's leave it to the family if they decide they want to explain that to the child. But right now, I want to do what I can to protect the identity of the baby as well as mom. My understanding is that both are progressing, recovering, and things of that nature. Okay. I don't know. I wasn't there. That's a question. I can tell you that when we responded, that was the thoughts.
Because the victim was a Native American, does that up is the FBI involved with this? Is it a federal case because of her status as a Native American?
First of all, I have not identified the race of the woman.
Well, the San Carlos Reservation came out and press release yesterday.
Let me just say this, that we have a great relationship with our federal partners. If we need to reach out to them, we certainly will reach out to them.
Who will be testing the DNA? Will that happen here in Phoenix or somewhere else?
I think it'll start with our lab, the Phoenix Police Department Crime Lab, and then there are times when we outsource things for certain tests.
Sergeant, if the baby was born at the facility, who delivered the baby?
My understanding is the staff was there when the baby was born. So I'm led to believe it was the staff that was on hand at that time. You're getting into a lot of things. I think, as far as I know, it was a natural birth. Now,
San Carlos Apache Tribe Police Department reached out to assist you in your investigation?
I don't know specifically if they have, but understand this, that our department has had great cooperation from our federal, state, and local partners.
Sergeant, the CEO of Hacienda resigned on Monday, not suggesting he did this in any way, but is he cooperating and is he looking at facing criminal charges because this happened under his lead?
At this point, I don't know. A lot of the questions you ask, I don't know. That specific question is best asked to the facility and the organization. So, now, real quick, just so you know, I've got a couple of people have asked for interviews, one-on-ones after this, including some of our national partners that are here, but I also want to make sure our local partners get interviews if they would like them. Okay? Thank you.
I'll be back in just a minute.